Medics will be used to bolster Gauteng's COVID-19 fighting capability. It's hoped the force multipliers will help frontline workers deal with overburdened facilities. The province is currently the epicenter of the outbreak. The Premier of the province, that's David Makhura, is there currently speaking. He's been speaking for a short while now. Let's go live there.
The institutions, the hospitals in our province, they must look after our soldiers who themselves are getting infected. I am very happy that tomorrow the team that is deployed here is getting vaccinated tomorrow. So you will know that the vaccination program first focused on the first category was the healthcare workers. The second category is those 60 years and above. The military had not yet vaccinated, but they are getting to the front line. As we speak right here, we have 96 COVID patients in this facility. 96 COVID patients. We've got 66 nurses that are from Chris Hani Baragwanath, as well as Charlotte Makhura. And the team from the military health services is going to rotate in groups. They will be bringing a particular number to complement those that we have here. But we would like to make sure that this reinforcement is not only here. We have other facilities. We've got Anglo Gold Ashanti. That facility today was supposed to start operating today. Full scheme. We opened it. There are doctors and nurses who have been deployed there. I was told this morning that there was some group of protesters who were trying to block them there. But we need additional deployments in this. We've got other facilities across the province that have been opened. We have, as I said, we have already contracted over 5,000 outside the staff complement. We have already contracted over 5,000 healthcare workers just to help us deal with COVID. But even that 5,000 that has been contracted to add to the current staff complement is not enough. So what are we doing? So yes, we can do with more healthcare workers in our facilities across the province. I know that unfortunately Charlotte Makhura is not operating, but all the staff from Charlotte Makhura are already deployed in the different healthcare facilities in Gauteng. They followed their patients. So there are no staff that are waiting who are not doing anything. They are in the various facilities so that when we open Charlotte Makhura, we are able to get them back there. But they are already working in the different healthcare facilities. So my message is our healthcare system, both in the public and in the private healthcare sector, is under tremendous pressure. The only way we can't determine how many more infections are going to happen. We can't determine that, but the behavior of our people in the communities can help slow down the impact of the pandemic. All we can do is to make sure that we spare no cent, and I want to say that we will spare no cent to make sure we have more beds and more beds and more beds. Last week, the MEC met with all the CEOs of our hospitals. All the hospitals in Gauteng have gone back to do what they did during the first wave. They've gone back, and Dr. Friedland told me they are doing the same in the private sector. They've gone back to look at every space and add an addition where you can add additional beds in an existing facility. We are looking for every opportunity to add additional beds in existing facilities. We are doing this because we know there are still going to be more people just given the infection rate that is happening now. A week later and 2 weeks from now, more people are going to be admitted in our facilities. And I'm speaking, this morning also there was a meeting between our private healthcare sector and the public health sector. I'm speaking on behalf of both the private healthcare sector and the public healthcare sector in Gauteng. As things stand, the healthcare system is... Anyone who thinks there are enough beds anywhere else, looking at the infections that have already happened, I take those beds taken already. I'm not saying there are no beds, but those beds, in 7 days' time, they will be taken. So we will continue to look for more beds, but one of the critical issues, both from the private and the public sector I'm getting, is one of the critical issues is more staffing, because our healthcare workers are under tremendous pressure at the moment. They are under tremendous pressure. And we will spare no cent from the health system point of view. But again, I want to say that if things go on the way they are, if in the communities, both in the suburbs and in the townships, if the restaurants continue to fill up the way they are filling up, if people continue to just go out and organize a birthday party or a party this and that, and let me tell you, there were Father's Day parties. And it may not appear like, even if it's just 10 people, where we are with the pandemic, 10 people are 10 dangerous people. Because the prevalence of the virus at this moment is that if you have 10 people, the likelihood is that in that 10, half of them may be carrying the virus. So we are going to need support from our communities. If you were to ask me, do you think this level 3 is working? We have not yet seen the impact and the results of level 3. We have not yet seen it. If what is happening over the weekend is anything to go by, it is not changing behavior. So the healthcare workers will do the best they can, but this battle will not be won by the healthcare workers alone. It can only be won, this battle can only be won if we start seeing less movement, we know there are people who go to work, those we understand, they travel at certain times. Those who go to work have to go to work. But just the general level of mobility in the province is not giving a sense that people are aware that we are at a very dangerous moment at this point in time in the pandemic. So I once more want to appeal to the people of our province that this pandemic, even those who are vaccinated, need to put on their masks. This message is important because those who are vaccinated think they are out of the woods. Not yet. We did a one-dose vaccine. Most of the people is a one-dose vaccine. So thank you very much to the team from the Military Health Services. But we need more and more support. And I say to our national government, any kind of support that the province will be given, we will welcome that type of support. We will welcome that type of support, but we need, this is in the hands of people in our communities. The infection rate is much, much higher than we have ever seen. We have breached by more than 2,000 what the peak was. We are not yet at the peak. At least there's from the team that's doing research for us. We are not yet at the peak, but we have already breached the highest peak of the second wave was 6,900 daily infections. We have already breached that by over 2,000 already. It is possible that in the next week and the week after, these numbers may still be going up. And when the numbers come down, they come down very slow. I want to emphasize that. Even if we can start seeing the numbers coming down, they come down very slow. And sometimes when the infection rate comes down, the hospitalization continues to increase 3-4 weeks after the numbers go down. So that's why the health services is our primary critical concern at the moment. The health services are going to be under pressure for a long while. I must say that we have been doing everything as the provincial government around making sure that that additional facility called Charlotte Maxeke is open. If you were to ask me, given where we are, if you were to ask me, I would walk in there tomorrow and open Charlotte Maxeke. We have looked at everything. We have taken legal advice. We have taken everything else. But getting over all those processes is too slow. Standing here, I feel like walking into Charlotte Maxeke tomorrow and opening it, even if there are areas that the city of Johannesburg has pointed out as needing attention. But given where we are now, definitely that's what I feel. That we should walk into Charlotte Maxeke and get it, because the additional Charlotte Maxeke is not about additional staffing, because those staff are already working. But those additional beds we need at Charlotte Maxeke. And every time we get to a point where it's like it is sorted, we are going to get the bed, we are going to open a certain section, and then they're always back and forth about technical issues related to the engineers and those who are approving. We, as I said, given the where we are with the pandemic, if things were according to me, I will walk in there into Charlotte Maxeke tomorrow and open the areas that the report, the engineers have said the fire did not affect those areas. I know everybody every day is calling, please open Charlotte Maxeke. And I definitely want to do that. In fact, I actually want to camp in there. It's my hospital. And I need to say, it is my hospital. I go to Charlotte Maxeke for consultation for long COVID, something that's called long COVID, which means lingering symptoms of COVID. I haven't had consultation at my hospital, Charlotte Maxeke. So those who are feeling that the hospital should be opened as of yesterday, that's where we are. But there's always issues of, in a country like South Africa, there's always issues of rule of law. You can't do this, Premier. That's what the lawyers say to me, Premier. You can't walk in there and get the hospital opened. Certain things need to be sorted out first. And the reality is that we are making this call. We briefed the minister to say we need every facility in Gauteng to be available for us to deal with COVID. So this house is burning. We have to douse the fire. And part of that is a function of what is happening in our communities, right there. And I want to emphasize, both in the suburbs and in the townships, across the board, across color, across class, people have just abandoned the compliance with the requirements. And this is very dangerous. We are in a very, very dangerous place called Gauteng right now. It's not safe at all for anybody. Even when you are at home, it is not safe. So let's take extra measures. Let's do anything we can to make sure we overcome, and we can only do so together. Thank you.
Thank you, Premier. I think what we're going to do now is that we're going to go into the